From pro athletes to weekend warriors, both can be sidelined with a groin injury, a painful soft tissue injury. A sports hernia is in a league of its own. Here's the latest in this week's Positively Healthy. Misunderstood and misdiagnosed, both could be said of a sports hernia, an acute condition that often leaves athletes sitting on the sidelines. Dr. Jonas Manson is a board-certified general surgeon.
So sports hernias are called sports hernias because it's generally an injury that we do see in athletes or people who play sports for fun.
A sports hernia often presents as groin strain. Given this diagnosis, athletes are advised to rest up until it passes. Failing to recognize the true condition can lead to a prolonged recovery. The pain from a sports hernia will return once players get back into action.
It's generally caused by straining of the hip muscles and the leg muscles, and it's a strain of the muscles. Sometimes the tendons and muscles can separate from the bone, or the periosteum as we say, or it can be a strain in the tendon.
While it's referred to as a hernia, this condition doesn't meet the true definition. In fact, it lacks one of the most pronounced features of a hernia, which is a telltale bulge or outpouching.
It's not a typical hernia that we say when there's a defect or a hole through the muscle. It's more of a strain in the muscle, and it's treated differently. The first line treatment is anti-inflammatory medications such as non-steroidal anti-inflammatory drugs, and physical therapy, stretching, and staying away from those exercises that caused that strain or sports hernia.
Sports hernias are typically caused by repetitive or explosive motions, especially those that require twisting of the pelvis, like football, tennis, basketball, hockey, soccer, and running. With prompt and proper treatment, athletes should be fit enough to play another day.
99% of the time I do treat it non-surgically. There are certain times where we do need to treat patients with surgery if they do have a complete tear of the tendon or muscle.